So now we're going to be covering Unit 2. Unit 2 will be chapters 4 and 5. Chapter 4 is what we're going to be focusing on for this lecture, which is the 4 main tissue types. And chapter 5 is the ingumentary system. So our 4 main tissue types are our epithelial, our connective, our muscle, and our nervous tissues. So tissues are formed by similar cells working together to form these tissues. If you remember back in chapters 1, 2, and 3, we talked about how we have our basic components, our cellular level, and then that cellular level combines to form our cell level, and now we're combining those cells to make that tissue level. So the 4 main tissue types, we're going to start with the epithelial tissue, which is comprised of roughly 3% of our body. Our nervous tissue is approximately 2% of our body. Our connective tissue makes up roughly 45% of our body, and our muscle tissue is 50% of our body. So once again, I had talked about how our chemical level combines together. Those molecules and atoms combine to make those cells, which creates that cellular level. And then those like cells combine together to create that tissue level and divide it into the 4 different types. So epithelial tissue covers and supports our surfaces. It lines our internal passageways and chambers, and it forms our secretory glands. So our prime example of an epithelial tissue is our skin. That is the biggest one. When we think of epithelial tissue, we think of our skin. So covers and supports that surface. So we are covering our entire body, protecting all those precious organs, those blood vessels, our neurons, our brain. It protects all those things that are inside our body. Then we have our connective tissue, which fills the internal spaces. It provides structural support, and it stores energy. So connective tissue kind of provides that cushion that we need between that outer epithelial tissue layer and that internal organ layer. Then we have our muscle tissue. This connects to produce movement. It includes our skeletal muscles, our cardiac muscle, and our smooth muscles. And then last but least, we have our nervous tissue, which conducts the electrical impulses, and this carries information throughout our body. So what are some examples of each type of tissue? So we start with our epithelial tissue. We kind of talked about that already, which skin is an example of that. But there are definitely some other ones. We have our sweat glands. We have our skin. We have the lining of our intestines, the lining of our respiratory tract, and the lining of our abdominal cavity. These all are comprised of the epithelial tissue. Then we have our connective tissue, which includes bone, cartilage, adipose, blood, and lymphatic. So those, as you can tell, are all very different in how their appearance is, how they feel, their texture. So the connective tissue can be solid, like bone or cartilage. It can be a little more fluffy, squishy, like our adipose tissue. And then it also can be very liquidy with our blood and our lymphatic. Then we have our different types of muscle tissue, which include our skeletal, our cardiac, and our smooth muscle. Obviously, skeletal muscle, those attached to our bones, they make our body move, all of our joints move. Our cardiac muscle is only comprised of our heart, and then our smooth muscle is comprised of our digestive tract, our uterus, and our blood vessels, just to name a few. And then last but least, we have our nervous tissue, which includes our spinal cord, our nerves, and our brain. So first we're going to start with the epithelial tissue. So epithelial tissue, like we saw before when we listed the different types of epithelial tissue, it has epithelia and it also has glands. So the epithelia covers exposed surfaces. It contains secretory cells. It lines the internal cavity and passageways, but it contains no blood vessels. It is avascular. There's no blood supply in our epithelial tissue. There's ways that we get blood to it, which we'll talk about a little bit later, but there is no blood vessels in our epithelial tissue. So that is definitely something that you need to remember. There could be questions that you'll see in your homework or your quizzes or even on the exams. What tissue is avascular? So you make sure you remember that it is epithelial tissue. And then we have our glands, which is divided into two separate types of glands. We have our exocrine glands and our endocrine glands. The exocrine glands secrete onto external surfaces, and our endocrine glands secrete hormones or prohormones into interstitial fluid that enters our bloodstream for distribution. So our exocrine glands are like our sweat glands, because we're excreting out to the external environment, or excreting it out of our body. The excreting inside. Those endocrine glands are things like our ovaries, our testes, our thyroid gland, our pancreas. These all have glands in them that secrete into our blood and deliver those hormones. So the epithelial tissue has major functions. So the first is physical protection, which we have talked about. I always refer back to, think of the skin when we think of epithelium. And then once you kind of can remember the different functions, then you can start to remember the different types of epithelial tissue and where it's found in the body. But if you think of the skin, it's going to help you remember these major functions a little bit better than thinking of like the digestive tract. So the physical protection, so once again, let's think of that skin. What does our skin do to our body? It helps protect our body, our inside of our body. So physical protection from abrasion, dehydration, and destruction from outside factors. This is an example of a stratified squamous of the skin. It helps control permeability, which is absorption, filtration, and excretion. Any substance that enters or leaves the body must cross the epithelium. This is absorbed through the GI tract, cells lining our gut or our kidneys. Filtration is our glomerulus of our kidneys, and our our excretion is our sweat glands. So also you can think of the skin for this one, controlled permeability. So our sweat glands are located just underneath the surface of our skin. So on hot days we sweat. That is helping control our temperature. It's helping control what substances are obviously exiting our body, because we want to excrete more of that waste out. So of course, like the GI tract, absorption through the GI tract, any kind of food, any kind of nutrients that you are consuming, your GI tract is going to absorb it, and then it's going to distribute it into your bloodstream, which can be transported throughout your body to be used elsewhere. It also provides sensation. Those sensory nerves that innervate the most epithelial. These examples are touch, smell, taste, sight, the equilibrium, and hearing. The skin or the hairs in our ear. These help with our equilibrium. They help with They help with our hearing. The nervous tissue is embedded in this epithelium. And then we have it produces specialized secretions. These produce secretions which are our gland cells, the nasal mucosa, the respiratory tract, our stomach, our cervical canal, and our lacrimal glands are all examples of these secretions that these gland cells can produce. So this is kind of just a cartoon picture of what a generic epithelial tissue would look like. So the epithelial tissue has these characteristics: high cellularity. They are very densely packed cells. We want them really tightly packed because these epithelial cells, no matter where they're at in our body, in our digestive tract, and our stomach, and our uterus, and on our skin, they help control that permeability. They help control what is going to come in and what is going to come out of that particular area of our body. So they're our gatekeepers. So if there's holes or gaps in between each of these cells, anything can slide in and out whenever it wants to. So we don't want that to happen. We want these cells really, really tight together. They have specialized contacts or junctions. They have polarity, which is apical and a basal surface, and they're supported by connective tissue. Why do you think it's supported by connective tissue? So we said before, on a couple slides back, that epithelial tissue is avascular. It does not have its own blood supply. So how does it live? We need that blood supply for our tissues and our cells to live. So That is why it's supported by that connective tissue, because connective tissue has a blood supply and it feeds on that basal surface, that bottom surface. It feeds the epithelial cells that blood supply that it needs. So then also the epithelial cells, tissues are can regenerate very rapidly. Their cell division and mitosis occur very quickly. That's why we shed skin so quickly, because we're constantly using it. It's constantly exposed to harsh environmental conditions, so it's having to regenerate much quicker to keep those cells fresh and alive. So up there on the apical surface, they line the internal passageways of the digestive, urinary, and reproductive tracts, and these are non-membranous organelles. So those little microvilli there at the top and those moticilli at the top are those that line those tracts, those digestive, urinary, and reproductive tracts, because like our digestive tract, these little guys help push things through our intestinal tract, but also they're important for grabbing nutrients from our food that we've consumed as we digest them. So something that I often test for in my practice is B12 deficiency. B12 deficiency is actually a very common deficiency in pretty much any age, but as we get older, we start to lose B12 a little bit easier, and also people who have Crohn's disease or ulcerative colitis or irritable bowel syndrome, chronic diarrhea, they are also usually very deficient in B12, because the only section of our intestine that absorbs B12 is our duodenum, which is the very first section that's connected to our stomach. And that duodenum has those little microvilli, those little nubs that grab those B12 nutrients. And people who are deficient in B12, actually those little nubs kind of break off, and they're still there, but they're not very big, so they're not able to grab things that they're supposed to. So it's kind of just a little tidbit on why do we have these? Why are they important? They're very, very important for various reasons all through our body. The apical surface also covers the apical surface of cells in portions of the respiratory and reproductive tracts. So obviously we want to help the sperm have a little tail, that cilia tail, to help keep it mobile, so it can swim to the ovum to fertilize that egg. And then also in the fallopian tubes, the fallopian tubes help push those eggs down into the uterus for possible fertilization. So the basal surface, it includes the base, which attaches to the deeper tissues, which is our connective tissue, which supplies our blood supply, and the sides where it connects with its neighbors. The apical surface faces the exterior of the body, or the internal space, and the base attaches to the adjacent tissues. Inside our epithelial tissue, we have these lovely little organelles, which we talked about in our cells. We have our Golgi apparatus, we have our endoplasmic reticulum, we have our nucleus, and we have our mitochondria in there. There's a lot of information on this slide, so if you want to take a minute, maybe pause it, kind of look through it, take some notes, because there's a lot of information on this about these epithelial cells. All right, so how do we classify our epithelial cells? This is something that you will also do in lab. So we're just going to kind of touch base on it really quickly, but lab is probably going to go more in depth than I will. But this is something that you definitely need to know, because it's going to be, you're going to see it over and over again. It helps you identify when you're looking at the microscope, identify what type of cells are they, and then potentially where in the body could it be. Okay, so how do we classify these epithelial tissues? I keep saying cells, and I'm so sorry. It's tissues. So the first name is the tissue, which equals the number of cell layers. And then the last name of the tissue is the cell shape. So we have our number of layers, and we have our shape of our cells. So our number of layers is either 1 or multiple. So if we have 1, it's going to be simple. If we have multiple, it's going to be stratified. So then we look, so once we decide, is there one layer or is there a lot of layers, then we decide, what is the shape of this cell? What does it look like? So we have 3 different shapes that we can choose from. We have squamous, we have cuboidal, and we have columnar. So the squamous kind of looks like, depending on which direction you're looking at it, but some people say it looks like a flat egg. It's just a flat, kind of just flat rounded surface, like an egg with a yolk in the middle of it, because you've got that nuclei in the middle of it. You have your cuboidal, which is cube shape, so it's a square, a cube. And then you have your columnar, which are long rectangles, long columns. So those are the 3 different types. So first we decide, how many layers are there? Are there 1, which would be simple, or multiple, which would be stratified? And then we decide what shape it is. If it's a cube shape, then it's going to be, if we have 1 layer and it's cube shaped, it's going to be simple cuboidal. So like I said, lab will get more in depth in this. You're going to look at things under the slide. You're going to be able to identify them and get a better visualization of how those single versus those stratified layers are different, and how each squamous, cuboidal, or columnar cells differ from each other. So the simple is only 1 layer. You can see the examples over there: the simple squamous, the simple cuboidal, and the simple columnar. And then we have our stratified, which are several layers, usually in areas that need protection from physical or chemical stress. For example, the skin and the lining of their mouth are very good examples of somewhere you'd find a stratified epithelium. Okay, so the epithelial tissue, to be an effective barrier, it must form a complete cover and lining and replace the lost or damaged cells quickly. This is determined by intercellular connections or junctions, which we talked about before. We want those junctions nice and tight and secure. So we have different types of junctions. We have a tight junction, which forms a barrier that isolates the basolateral surfaces and deep tissues from the contents of the lumen. This makes it waterproof. So those tight junctions, which you can see over there in that little picture, where a tight junction would be located, this makes our epithelial tissue waterproof. So examples of tissues and cells that have tight junctions are cells that line the intestinal tract. We don't want anything leaking out of our intestinal tract, and we don't want anything coming in that doesn't belong in there. So especially, we don't want all that waste that we're processing and pulling out our nutrients. We don't want all that waste to be leaked out as well. So we want everything to be really, really tight and waterproof in there. And then we have adhesion belts. These are locks that are terminal webs of neighboring cells. They strengthen the apical region and prevent distortion and leakage at the tight junction. They are a continuous band. So when I think of an adhesion belt, I think of a belt. What is a belt's job when we put it on our body? It's to keep our pants up, to keep everything tight in there, so make sure our pants don't fall down. So this is the same concept with this adhesion belt. This is just a reinforcement of that tight junction, wrapping around that tight junction, making it really, really tight, so those 2 cells are pulled even closer together. So it's just a reinforcement of that tight junction. So then we have our gap junction, which this permits chemical communication that coordinates the activities of adjacent cells. And that's down there toward the bottom. All right, then we have our desmones, which are below those, on the other side of those gap junctions. You can see that there. The desmones are a ligament body. They provide firm attachment between neighboring cells by interlocking their cytoskeletons, which are very, very strong. And then we have our hemidesmones, which attach the deepest epithelial cells to the basement membrane. So these guys are anchoring those epithelial cells down to the connective tissue. They are keeping them secure there so they don't shift and move around. So here's an up-close picture of those hemidesmones. So you can see them there. They are kind of that kind of, I don't know, it's like a tan grayish kind of color. They look like those little webs that are the little teeth that are going down there through the basal lamina. So they are non-cellular structure, which is the basement membrane is a non-cellular structure that is produced by the basal surface of the epithelium and the underlying connective tissue. We have our basal lamina, which is our layer with no specific form that contains the glycoproteins, and it's produced by an adjacent layer of the epithelial cells. And then we have our reticular lamina, which has the reticular protein fiber and ground substance that is secreted by the underlying connective tissue cells. This provides strength and acts as a filter that restricts diffusion between adjacent tissue and the epithelium. So just kind of a recap. There's those tight junctions there at the top. This prevents passage of water and solutes. This makes the epithelial tissue waterproof. Then we have our continuous adhesion belt, which creates that band. It helps encircle the cells and binds the cells to its neighbor to create that even tighter junction. We have our gap junction, which is two cells are held together by coaxons. The coaxons are channel proteins that form narrow passages, which allow small molecules and ions to pass cell to cell. And our desmones, which are opposing plasma membranes that are locking together. So all these things are all different checks and balances of the epithelial tissue to ensure that it is truly waterproof and nothing is passing through that it doesn't decide, okay, I'm going to let you pass through. We also have cell adhesion molecules, are also known as CAMs. They are transmembrane proteins that bind to each other and to extracellular materials. CAMs are on the basolateral surface of an epithelium, and they help bind the cell to the underlying basement membrane. The membrane of adjacent cells may also be bonded by a thin layer of proteoglycans that contain polysaccharide derivatives, most notably the hydroluric acid, which I'm sure we have seen hydroluric acid, especially females, in various beauty products. So what the hydroluric acid, is very strong. It helps resist stretching and twisting, and it's found in our superficial layers of the skin. So these beauty products are saying, hey, I'm going to give you more of this hydroluric acid, and it's going to make your skin firmer, and those fine lines and wrinkles are going to go away. Whether or not this is true or not, whatever. But it's a really good sales gimmick, and a lot of people still buy it. So, but that's what the hyaluronic acid does. It helps keep that skin nice and plump, and helps with those fine lines and wrinkles. All right, so we have 8 types of epithelial tissue. So remember how we classify them. We have simple, which is that single layer. We have stratified, which is that multiple layer. Then we have the squamous shape. We have the cuboidal shape, and we have the columnar shape. There's also 2 other different types that we're going to throw in there just because, why not? The body's fun like that, and we can't always follow all the rules. So, like I said, simple is 1 layer of cells. The stratified is more than 1 layer of cells. And then our last name is our squamous, cells that are wider than tall, like a plate-like, squashed, or egg-like appearance. Cuboidal, these cells are as wide as tall, they're cubes. And those columnar, those cells are taller than they are wide, and they are columns. So our simple squamous epithelium, this is a single layer of flattened cells. It is our simplest of our epithelial. It's very delicate. Its main function is absorption and diffusion, and it's found in our endothelium, our mesothelium, our capillary walls, the inside of our eye, and our lung alveoli. Our simple cuboidal epithelium is our single layer of tube-like cells. The function is absorption and secretion, and it is found in our ducts and our kidney tubules. And then we have our simple columnar epithelium, which also is a single layer of tall cells. The function is absorption, those microvilli, secretion of mucus, and cilia for movement of that mucus. Examples are it's found in the GI tract. They line the stomach, the intestinal wall, the gallbladder, the uterine tubules, or the kidney ducts. Now, here's that extra little one that I alluded to. That here's number 7 and number 8. So we have pseudostratified ciliated columnar epithelium. So pseudostratified, when you look at that picture, it looks like it's stratified. It looks like it has more than one layer. But in reality, it actually is only one layer. So it's a single layer of cells at different heights. So those cells are all different shapes, or not shapes and sizes, but they're all different sizes, and they're all squished in there together and kind of distorted. So it kind of looks like it's a multiple layer, but it's really only a single layer. The function of this is for secretion of mucus by the cilia, and it's found in our trachea and our upper respiratory tract. Then we have our transitional epithelium. This looks both like stratified squamous and stratified cuboidal, depending on what stage it's going to be in. It changes shape, it stretches, and that's why we get both that appearance of the stratified squamous and the stratified cuboidal, depending on when it stretches. So this points to, okay, where is it found? It's found in the bladder. They're also known as like an umbrella cells because of how they when the bladder is distended and it's full of urine, that umbrella opens up and those cells become flat and thin, looking like that squamous. Then when we urinate and the bladder contracts, those cells those cells squeeze back down to push all that urine out, and they kind of blow up again, and now we have that cuboidal appearance. So this is a really neat, I enjoy the transitional epithelium because it's just neat. It's unique in appearance. No other cells in the body are going to mimic it like this. So it's just kind of fun. All right, now we have our stratified squamous epithelium. So this is our multiple layers, whereas all the other ones were single layers, except the transitional. The transitional was a multi-layer. So we have the stratified squamous is our thick membrane with several layers. It's located where severe mechanical or chemical stress exists. It is non-keratinized, which is found in the moist linings. And keratinized is dry. The function is protects the underlying tissue from abrasion. The examples are our skin, of course, because that is where we get our most abrasion and exposure. Our esophagus, because because we are drinking, we're eating different types of textures of foods, different types of liquids. So that's going to be exposed to multiple different environmental factors as well. Our mouth, because we're putting everything in our mouth that we're eating or consuming. Our anus and our vagina. So our anus because we're having to excrete out those wastes, and our vagina because, well, we have babies, so we have to have a lot of protection when we are trying to have birth a child. Then we have our stratified cuboidal epithelium, which is rare. It's only 2 layers of cube-like cells. Its main function is protection, and it's found in our sweat glands and our mammillary glands. Then we have, last but least, our stratified columnar epithelium, which is also several layers. It's also not as common, it's rare as well. The functions are secretion and protection, and it's found in the pancreas and the saliva glands. So we have our glands because they are part of our epithelial tissue as well. The collection of the epithelial cells that produce secretions. We have our endocrine and we have our exocrine. So our endocrine, they release secretions into our blood. This is an example of the insulin from the islet of the Langerhans, which is found in the pancreas. Also our thyroid, which secretes our thyroid hormone, our TSH, our free T4, our free T3. We have our ovaries and our testes, which secrete our testosterone, our estrogen. So there's multiple various endocrine glands in our body that secrete lots of different types of hormones. Our exocrine glands, which exo means out, so this is release secretions into our ducts. We have 3 different types of exocrine. So our endocrine, just be familiar that it's there. You're going to really cover endocrine more in AP2. So our exocrine, we're going to focus mainly on. We have our merocrine secretion, our apocrine secretion, and our holocrine secretion. Our merocrine secretion is released by exocytosis, and this is our most common mode of secretion. Our example is our mucus. And then our apocrine secretion, apo means off. This is release of the cytoplasm and the secretory product. An example is our milk production, which is actually a combination of our merocrine and our apocrine excretions. Then we have our holocrine secretion, which is cell destruction. The entire cell becomes packed with secretory products, then bursts. It releases secretion and kills the cell. This is an example of a sebaceous gland. I always think this analogy is like a pimple or a zit. The pimple pops, it bursts, the pimple's gone. So that's the same concept with the holocrine secretion. So the exocrine glands are classified by the structure as well. So we have our different structures and our shapes. So our shapes are tubular, sac-like, which is our alveoli, or our tubulo-alveoli. The relationship between the ducts is simple or compound, and the secretory areas are branched or not. So these are all examples of simple single ducts. We have our simple tubular, which is found in our intestinal glands. We have our simple coiled tubular, which is found in our merocrine sweat glands. We have our simple branched tubular, which is found in our gastric glands, and our mucus glands of our esophagus, tongue, and duodenum. We have our simple alveolar, which is found in a stage in the embryonic development of simple branch glands. This is not found in adults. And we have a simple branched alveolar, which is found in our sebaceous glands. Then we have 3 different compound types. This divides in one or more times. So looking at the last slide compared to this one, you can see how there's different branches. You can think of like a tree and all the different branches. So we have our compound tubular, which is our example is our mucus glands in our mouth, our bulbar urethral glands in our male reproductive system, and our seminiferous tubes are of the testes. We have our compound alveoli, which is our mammillary glands. And then we have our compound tubular alveoli, which are examples are our salivary glands and our glands of our respiratory passages and our pancreas. Then we have a specialized gland called the goblet cell. The goblet cell is only found in the digestive tract. It's only a unicellular exocrine gland, so there's only a single cell. They are interdependent of each other. They are scattered secretory cells in the epithelium. They secrete mucin, which forms mucus, which then helps the food move through our digestive tract. So they are, like I said, they are scattered throughout our epithelium in our digestive tract. They they secrete mucin, which forms mucus to help move that food and the waste particles through our digestive tract. So they have a really important job. Okay, so now we're moving on to types of connective tissue. We have 3 different types of connective tissue. We have fibrous connective tissue, supportive connective tissue, and fluid connective tissue. So if you remember back from one of the very first slides where we were talking about all the different types of epithelial, different types of connective, different types of muscle tissues, remember how the connective tissue was very, very different. We had bone, we had blood, we had fat, so all of them were very different in appearance, and this is why they're different in appearance, because there's 3 different types of that connective tissue. So the fibrous connective tissue, we have loose and dense fibrous connective tissue. So the loose fibers create a loose, open framework, and the dense fibers are densely packed. So an example of loose is our areoli, our reticular and our adipose tissues. Our dense are our tendons and our ligaments of those fibrous. So in our supportive are our cartilage and our bone. So when you think of supportive, think of supporting your body. What helps your body function? What helps give your body structure and support? That's going to help you determine or remember what to fall into this category. So we have cartilage and we have bone. So bone, of course, is solid yet flexible matrix because we find cartilage. Cartilage connects our bones to other bones. So, for example, the cartilage that connects our ribs to our sternum and our chest, it's flexible, but it's not super flexible. Our chest isn't wiggling around and flopping all over the place. It still holds its structure, but yet if we have some pressure or some impact, we do have some flex of that cartilage and of those bones to help protect our heart and our lungs. Then we have our bone, which is solid and rigid, solid in a rigid matrix. So examples of cartilage, the different types of cartilage, we have hyaline cartilage, elastic cartilage, and our fibrocartilage, which we'll talk about a little bit later. We have our bone, which is comprised of spongy and compact bone. So we have two different types of bone depending on where it's found. And then we have our fluid connective tissue, which includes our blood and our lymph. This is contained in the blood vessels, which is our blood, obviously, and our lymph node is contained in our lymphatic system. So those three pictures down there of the connective tissue, the supportive connective tissue, and the fluid connective tissue, it just shows how those different matrices of each different subtype are very different from each other. So that fibrous connective tissue is going to be, it's going to be more loosely packed. You're going to have a little more wiggle room. Think of that adipose tissue. You're going to have a little more give, just a little more fluidity throughout it without it being completely fluid. So then you have that supportive connective tissue. There's an example of bone and cartilage right there. It's more densely packed. It's very rigid. It's not going to have as much give and squish as that adipose tissue. And then you have that fluid connective tissue, which is all liquid. It's that serous kind of, it's almost like I describe it as syrup, like a syrup type consistency. That's what that fluid connective tissue matrix looks like. Okay, so functions of our connective tissue. So as you're going to learn throughout this semester, I like functions. So I always tend to put a little asterisk or a little important next to it, because if you don't understand what is the function of something, how are you going to be able to describe it or to be able to understand what it does for us? So the functions of our connective tissue is to establish a structural framework for the body. So establish a structural framework. Think of our bones, think of our cartilage. That is our pure definition of framework for our body. It transports fluids and dissolves materials. So our blood and our lymph is a good example of that. It transports different nutrients, oxygen. It gets rid of our waste in our body. The lymphatic system does. So all those things are going to help transport those fluids and materials. It protects our delicate organs. Think of our rib cage, our skull. These are protecting our delicate, precious organs that we need to survive. Supports, surround, and interconnects other types of tissues. So our bones are connected to our muscle, our skeletal muscle. So that's an example of how it's supporting, surrounding, and connecting other types of tissues together. It stores energy, especially in the form of triglycerides. And it defends the body from invading microorganisms. Characteristics of connective tissue. They vary widely in location and function. So think about the different types of connective tissue we have. We have the supportive, we have the fluid, we have bone, we have cartilage, we have blood, lymphatic. They're all very different in appearance, in texture, in density. So that's depending on their location. such as the bones. They're throughout the body providing structure and support. We think of those locations as well as the function of what that connective tissue does to help us determine what kind of ground substance it's going to have, what kind of different characteristics, job that it's going to be doing throughout our body. It is never exposed to the surface. So remember, connective tissue is the underlying surface to our epithelial tissue. For most connective tissue, they are the blood supply to the epithelial tissue. But it does range from highly vascular to avascular. So vascular means it does have that blood supply. So most connective tissue has its own blood supply and also supplies it to the epithelium tissue that it is supporting. However, we do have one avascular connective tissue. Does anyone remember what that avascular tissue is? So that avascular tissue is the cartilage. Cartilage is the only connective tissue that doesn't have its blood supply. So like the epithelium, it gets its blood supply from its surrounding tissues. That synovial fluid that in the joint, that supplies that blood supply to that cartilage. They may contain sensory receptors. All connective tissues have 3 components. They have specialized cells, for example, like fibroblasts, osteocytes, chondrocytes, red blood cells. So depending on which type of connective tissue it is, those different things, for example, osteocytes are bone cells. The chondrocytes are cartilage cells. Red blood cells obviously are in our blood. So the extracellular protein fibers and the ground substance are what make up our extracellular matrix. This extracellular matrix, is what surrounds the cells. It accounts for the majority of our connective tissue volume, and it has fewer cells and more extracellular material when we compare it to the epithelial tissue. So this cartoon image is an example of an extracellular matrix with all its components. The connective tissue components include the extracellular protein fibers, which is made up of our collagen, our elastic, and our reticular fibers. The collagen fibers are very thick and very strong. Collagen is what gives our, for example, our skin, it keeps our skin nice and soft and supple. It helps with those fine lines and wrinkles. So the the connective tissue below our skin is our subcutaneous fat, and that collagen fiber keeps that skin more elastic and more younger looking in appearance. So as we age, we start to lose some of that subcutaneous fat, we start to lose some of that connective tissue, and therefore that's why we start to get wrinkles. The elastic, they are slender and stretchy, so the elastic gives the connective tissue its stretch. So it's like a rubber band. It's going to stretch out and then it's going to snap back into place. And then our reticular are very strong and branched or curly. These are more like our branching stem work of our trees. For an example, it gives it a little more structure, a little more stability. It's not as flexible as the collagen or the elastic fibers. Then we have our ground substance, which is clear and colorless. It's very viscous, which is like a syrupy type consistency. And this is due to the presence of the proteoglycans, which are carb and protein components, and the glycoproteins, which are sugars and proteins. Then referring to the image, the diagram there, you have your fixed cells, which are stationary. They're involved with maintenance and repair and energy storage. The components are melanocytes, which synthesize melanin pigment. The fixed macrophages, which engulfs a cell debris and the pathogens. We have our mast cells, which stimulate inflammation and mobilize against defenses. They are filled with histamines, which cause our skin to be very itchy. Mast cells, we will talk about a lot throughout our section. Mast cells are really important in repair of the skin tissue. They're important for obviously the inflammatory response, any kind of allergen, which creates that itchy response. So if you ever have had, obviously we've all had cuts and scrapes, and as that cut is starting to heal, that nice pink pretty skin or even that scar tissue, that scab, becomes very itchy. That's because of those mast cells coming in to help repair that tissue. Then we have fibroblasts, which synthesize the extracellular fibers. These are younger cells. And then we have our adipocytes, which store our lipid reserves, and our fibrocytes, which are differentiated from fibroblasts and maintain the extracellular fibers, which are our older cells. So those fibroblasts are our younger cells, and our fibrocytes are our older cells. Then we have wandering cells. These are more throughout our tissue. They function in defense and repair. We have our plasma cells. They are immune cells that produce antibodies. We have our free macrophages, which engulf debris and pathogens as well. So the fixed macrophages are stationary. They are where they're located, kind of, where they are is where they stay. And then those free macrophages kind of float around, finding that debris and those pathogens to engulf and get rid of. The mesenchymal cells, which are stem cells that aid in tissue repair. Our neutrophils and our eosinophils, which are phagocytic blood cells. So and then our lymphocytes, which are our immune system cells. So when we check a CBC on a patient, part of the white blood cells are going to be those neutrophils, those eosinophils, and those lymphocytes, because they're going to give us an idea of what, if they're elevated or decreased, what's going on in our extracellular matrix of our blood. What's happening? Is there infection that we're trying to fight? Is there an allergic reaction? Is there possible cancer cells going on in there? So all of these will tell us where to look and how to investigate to find out exactly what's wrong with that patient. Okay, so now the loose connective tissue. This is fibrous connective tissue. We have two types, the areola, and then we have our adipose. We have three types, areola, adipose, and our reticular. So our areola is our most common type of loose connective tissue. Going back to that previous slide, looking at that image right there, that is what an areola tissue is theoretically going to look like and what it's going to have consist of. Like I said, it's the most common type of loose connective tissue. This is our general packing material of the body. All the cells, the fibroblasts, the white blood cells, the lymphocytes, the monocytes, the neutrophils, eosinophils, macrophages, all these types of cells are hanging out in this type of areola connective tissue. And it's located in the papillary layer of our dermis. And then we have our adipose tissue, which this type of cells make up the most of our tissue volume. Adipose tissue is our fat cells, so that would make sense why it makes up the most of our tissue volume, because the fat cells can expand and shrink, obviously depending on location, the weight of a person. They are found in our hypodermis layer, and they form pads around our eyes and our kidneys for protection. They obviously form pads around our other organs as well. We can get more fat around our liver. We can also, when we do blood work, we can see that those liver enzymes may start to increase if we're getting too much of that fat build up around that liver. It protects our intra-abdominal cavity. Think of all of our adipose fat inside of our abdomen cavity, which helps protect all those precious organs. Then we have our reticular loose connective tissue, which is our liver, our kidneys, our spleen, our lymph nodes, our bone marrow, which provides such support and structure for our body. So remember when we talked about the different types of elastic, collagen and reticular, this kind of goes with that same concept, because the reticular provides that support structure. The reticular a little more stiff, not as much give to it as well. Then we have our dense connective tissue. So we have our dense regular, our dense irregular, and our elastic. So our dense regular, this is found with our tendons and our ligaments. The tendons are connecting to our skeleton muscles to our bones. Those ligaments interconnect bone or stabilize the positions of organs, and the collagen's arranged in the parallel bundles. So the images over there, the top image is going to show you what that dense irregular tissue is going to look like under that microscope when you see it in lab. Then we have our dense irregular tissue. The fibers are arranged in a meshwork type pattern. They strengthen and support the areas of stress, and they cover over the visceral organs, the superficial layers of bones, cartilage, and those peripheral nerves. They are very thick and supporting the reticular layer of the skin and which is also known as the dermis. Then we have our elastic layer, which is very springy and resistant. The more elastin fibers, there are more elastin fibers than cartilage in this connective tissue type. It is very springy and resistant. It's found in our intervertebral discs, the walls of our large vessels, our erectile tissue of our penis. So the reason why we want the elastic tissue in our intervertebral discs, think of all the impact that our spine goes throughout the day. We're standing, we're sitting, we're walking, possibly running, as children, jumping up and down. If we fall, there's so many different movements that we do that are going to need that resistance, that springy cushionish of the vertebral disc to help cushion our spine, protect our spinal cord. And then, of course, the walls of our large vessels. So as the blood pumps through our vessels, we want those vessels to constrict and relax as need be to keep our blood pressure regulated. And then, obviously, the erectile tissues of the penis. So for a male to get an erection, we want that tissue of the penis to be able to become more dilated and harder with those vessels, as well as that tissue to create that erection. Then we have our blood and our lymph. This is our fluid connective tissue. The fluid has many types of suspended proteins, and of course, it's a watery matrix. There are no insoluble fibers located in the blood or lymph. Obviously, there's two types that are found in that are considered fluid connective tissue, which are the blood and the lymph. Blood, this is a plasma matrix. It's a very watery matrix. And its formed elements, the blood cells and platelets, are suspended in the plasma. So we have, within our blood, we have red blood cells, which shows that picture there. It kind of looks like little donuts. Then we have our white blood cells, which have many different types of white blood cells. We have monocytes, lymphocytes, neutrophils, basophils, and eosinophils. And then we have our platelets. So the red blood cells, their important job is to transport oxygen throughout our body. That is one of the most important jobs of our red blood cells. So without our red blood cells, we couldn't transfuse that oxygenated blood from our lungs, through our heart, down through our vessels, and through our entire body to help all of our tissues and our organs sustain life. So that is the number one job of our red blood cells, is to transport that oxygen. It is roughly half the volume of our whole blood. So when we look at our blood matrix, half of our volume of our blood matrix is consistent of those red blood cells. And of course, red blood cells gives the blood its pretty red color. Then we have our white blood cells, which there are multiple different types of white blood cells. The white blood cell's main purpose is to defend the body from infection and disease. So the different types of white blood cells are monocytes, which are important in phagocytosis. They collect all the debris and pathogens that we don't want in there and help get rid of it from our body. We have our lymphocytes, this is the dominant type of cell in our lymph nodes. Our eosinophils, which are also phagocytosis, the neutrophils, phagocytosis, and the basophils promote inflammation. And then last but least, our platelets. These help us form clots. So if we have any kind of injury or if we're bleeding too much, the platelets help create the clots. And this stops and prevents us from bleeding to death. Okay, so now we have our lymph. the extracellular fluid circulation of our lymph system. We're going to start there with number one is our arteries. They carry our oxygenated blood away from our heart. Then we go down to number two, to our capillaries, which is the smallest and delicate blood vessels. This is an all exchange between blood and interstitial fluid occurs here. Then we have our capillary network, number three. The water and solutes from the bloodstream are pulled into this capillary network. And then number four, the lymph forms as interstitial fluid enters the lymphatic vessels. Number five, the lymphatic vessels form a network. And then we have our veins, number six, that carry that deoxygenated blood back to the heart. And then it goes back into the lungs and the heart to reoxygenate that blood and start the whole process again. So the lymph forms as interstitial fluid drains into the lymphatic vessels that begin in the peripheral tissues and empty into the venous system. This is a continuous recirculation of extracellular fluid, and it's really important for homeostasis. This helps eliminate local differences in levels of nutrients, waste, toxins. It maintains blood volume and alerts the immune system to infection. So a simple example of how the lymphatic system works, we have lymph nodes throughout our entire body. So when I describe the lymphatic system to a patient, I describe it as our sewage system. It's how we get rid of waste from our body. So our lymph nodes in particular are kind of little reservoirs that help pull all that waste out of our body and out of our bloodstream. So when we have any kind of infection, for example, if we have a sore throat, if we have maybe a cut on our underarm area or on our shoulder or somewhere like that, the lymph nodes in that general area, for example the throat, the lymph nodes in our neck are going to start to swell because they're trying to take that infection from your bloodstream that are localized in your throat area and start to drain all that debris and pathogens and infection out. And same thing like with if you had an enlarged lymph node in your underarm, you have some kind of cut maybe on your arm or your shoulder or your upper chest area, your body is trying to take all those pathogens, all that bad stuff, and drain it out of your body. So those lymph nodes are going to become they're working harder, so they're going to become a little more swollen, tender, maybe even warm to the touch, because they're working harder than they usually are intended to do. So that's a simple example of how the lymph system works. A more complex example would be someone who has lymphadenopathy. So lymphadenopathy mainly can affect any part of the body, any appendage, but a lot of the times it can affect, as we get older, it can affect the lower legs, ankles, feet, and even the lower calves. That venous system and the arteries are pumping that blood down, pumping all that waste down there. But then when it gets down to that part where we got to separate that extracellular fluid, the extra fluid out, we got to separate all those pathogens out, get rid of all that waste. The body's just not able to do it as well as it should. And then those veins pulling that deoxygenated blood back up to the heart, which has been cleaned and purified, those veins aren't working as well as they should. Those doors that push everything up aren't working as well. So we get lots of swelling in our lower legs and our feet. Sometimes they can do, usually we just say, okay, wear some compression stockings, because compression stockings help kind of mimic the job that lymphatic and those veins are supposed to do. If that doesn't work, there's different things like lymphatic massage. There's physical therapists that specialize in that kind of therapy. They do wraps to help stimulate the circulation and help push that fluid back up like it's supposed to. So there's all these different ways that the body shows us, is that lymphatic system working too hard? Is there a lot going on? Is there a lot of toxins in the body? And it's trying to regulate itself and maintain that homeostasis. Okay, so now we're moving on to our supportive connective tissue with cartilage. The cells of our cartilage are called chondrocytes. They come from chondroblasts, which are our baby cartilage cells, and they live in these little things called lunica, which are little small chambers. And it also means lake. So they kind of look, if you look at them under the microscope, they kind of look like a little lake. The matrix of our cartilage is a watery gel containing the chondroitin sulfates, which is a polysaccharide. It forms a complex protein to make those proteoglycans, and it is also avascular. So remember, we've talked about two different types of tissue that is avascular. We have our cartilage, and we have what other tissue that is avascular? The epithelium. Epithelium is avascular because the connective tissue, except our cartilage, is very vascular, and that connective tissue supplies the epithelium with its vascular supply. So the same thing with our cartilage. It's avascular, so our surrounding tissue, our surrounding perichondrium supplies that cartilage with its blood vessels. So there's three different types of cartilage. We have our hyaline, our elastic, and our fiber cartilage. The hyaline, I've had a little cold and my nose is a little stuffy. So the hyaline is stiff but flexible, and it reduces friction. It's found at the ends of bones, our nose, and our trachea. Then we have our elastic cartilage, which can distort and return to its original shape. So a good example of that, an elastic cartilage is our ear, because you can bend that ear down and it pops right back up and goes right back to its normal shape. And then we have our fiber cartilage, which is durable and tough. It's found in our knee joints, our intervertebral discs, and between our pubic bones. So that fiber cartilage, think of areas that is going to have a lot of high impact activity. It needs to be a little more durable, a little tougher, a little more stiff. All right, so here's some images of what you possibly might see in lab for those different types of cartilage. The top one there is the hyaline cartilage. You see those little lunica there. They look like those little lakes, those little discs. You have the fibrocartilage on the next level, which is the example they're giving there is the intervertebral disc. And then last but least, you have the elastic cartilage of the ear, and just see how different they look in appearance. Okay, so cartilage obviously grows. Because we grow, cartilage needs to grow as well. So cartilage grows in a couple different ways. The first way is appositional growth. The cartilage grows at the surface. It has layers to our surface. So it's done by those chondroblasts, which are immature chondrocytes. They start to divide in the cellular layer of the perichondrium. Those chondroblasts secrete new matrix, and then what's surrounded by this new matrix, those chondroblasts mature into the chondrocytes. So they keep, as that little image over there shows, we keep adding layer upon layer upon layer. It's kind of like the growth of a tree. We're adding layer upon layer upon layer. Then we also have interstitial growth, which is growth within the cartilage. Those chondrocytes start to divide within that lunica, that little lake. The daughter cells then secrete additional matrix and start to move apart. They both types of cartilage of growth. Both types of growth occur during development, but as adults, little to no growth or repair usually does not occur of that cartilage. So typically, when we have damage of that cartilage, the main goal is to usually go in, an orthopedic surgeon will go in and kind of clean up that cartilage, clean up any rough areas, any loose fragments, and try to repair it as best they can, in hopes that long-term effects, there'll be less inflammation, hopefully less bone-on-bone irritation and rubbing of the joint, which causes more inflammation and swelling of the joint. Sometimes with just a little bit of damage to the cartilage, you can have a little bit of appositional growth happen as a young adult. It just depends on the type of injury that occurred. Then we have our bone or osseous tissue, which is our supportive connective tissue. The cells of our bones are called osteocytes, and they are from our osteoblasts, which are immature bone cells, and then those osteoclasts, which are our mature bone cells. The matrix is made up of very little water. It is mainly a solid consistency because we want our bones nice and strong, right? We don't want them fluidy, to give a lot of give. We want them nice and strong to maintain our support and structure of our body. They are crystals of calcium salts and collagen fibers. It is a crystalline matrix. We consider this a crystalline matrix. The small volume of ground substance, so 2/3 of its matrix is that calcium salt, which provides our strength for our bones. It is made mostly of calcium phosphate, and there's a little bit of calcium carbonate. So if you don't have enough calcium in your diet, because your bones are made up of such a large amount of calcium, your body starts to go after it in your bones. So if there's not enough calcium in your blood or in your diet circulating through, then your body's going to start to steal it from your bones because there's such a high source of calcium in your bones. So over time, as we're starting to steal more and more calcium of our bones, what happens to our bones? Our bones are going to start to become weaker. They're going to become more brittle, and that's where we start to see that as we age, we start to see more of that concept of the osteopenia, osteoporosis, where those bones start to become more brittle and fragile. Okay, so then the other third is going to be consisting of those collagen fibers, which helps provide some of that flexibility that we have in our bones. It's still strong, but it creates more of a flexible resistance to shattering. So we want our bones to have a little bit of give, a little bit of flexibility. It's because if we fall, if we jump up and down, if we trip and land on an outstretched hand, yes, we could fracture our wrist or our forearm or any part of our body, but the likelihood of fracturing it is a little bit less because our bones have a little bit of give. So depending on, obviously, there's physics, and depending on that force on that bone, it will determine whether or not, okay, did I just really hurt myself and bruise myself, or did I actually break my arm. So the bones are actually very vascular. We have a good blood supply in our bones. It's surrounded by our periosteum, except in our joint cavities. It has the hyaline cartilage. And there's two different types. We have compact bone and we have spongy bone. So here are some images of the like a cross-section of some bones. So we have this is our long bone structure that we've cut there. It shows our compact bone and our spongy bone. So our compact bone is going to be found on the outside. That's our stronger outer layer of our bones, which helps protect our bones and provides that structural support. And then on the inside is our spongy bone. This lines our internal cavities, and it is our finer network of our bone tissue. So this matrix is organized into different types of layers. It's organized into functional units called the osteons. That central canal contains our blood vessels. The osteocytes, which are our cells of our bones, are located between our layers. And those caniculi, which are little canals, they connect the osteocytes. The superficial layer is solid, calcified bone, and this prevents our interstitial growth. So our compact bone is surrounded by our periosteum, which is our outer layer of our bones. The compact bone has two different layers. We have our outer fibrous layer, which allows attachments of our ligaments. And then we have that inner layer, which is our cellular layer, which allows the oppositional growth and repair. So remember, oppositional growth is layer upon layer upon layer, like a tree. And the interstitial growth, remember, from cartilage is growth from within. So we don't want our bones, and we're going to get into it a little bit later. We don't want our bones becoming keep layer after layer after layer after layer. We don't want it to also grow from the inside, because we want our bones actually to be hollow, kind of with that spongy compact bone inside. Because if we keep adding layer upon layer of really hard compact bone, those bones are going to become really heavy. It's going to be almost impossible to move our bones around, to move our body around, because that bone structure is going to be so extremely heavy. So that defeats the purpose of that structure. So there's checks and balances that the bone cells do to help prevent that constant buildup of bone, and we're going to get into that in just a little bit. Okay, so down there at the bottom, is a comparison of cartilage and bone. So our cells for our cartilage are called chondrocytes, and the bone is called osteocytes, and they both have that lunica. The ground substance of our bone is a small volume of liquid surrounded by insoluble crystals of calcium salts, whereas our cartilage is the chondrian sulfate, which is the proteoglycan in water. The fibers in cartilage are collagen, elastic, and reticular fibers in varying proportions. And in bone, we have collagen fibers mainly. Vascularity in our cartilage, remember it's avascular, there's no internal blood vessels. And in our bone, we have very extensive blood vessels, so it is very vascular. The covering of our cartilage is called the pericardium, which also has 2 layers. And in our bone, we have our periosteum, which has 2 layers as well. And then the strength of our cartilage is limited because it does bend in easily, but it is hard to break. And then our bones are very strong. It resists distortion until a breaking point. Remember, that force of that bone eventually will cause that bone to break. Okay, so we have membranes now, which is the epithelium supported by connective tissue. Membranes line or cover our body surfaces, and they typically consist of epithelium supported by connective tissue. There are 4 different types of membranes. We have mucosous membrane, our serous membranes, our cutaneous membranes, and our synovial membranes. So those mucous membranes, they line the exterior passageways. So mucous membranes, they're going to create mucus. They're going to, like, for example, mucosous membrane is our mouth or our anus or our vaginal opening. These are all examples of mucosal membrane because, one, they line an exterior passageway, something that anything can come out of our body, out of this passageway. Then we have our serous membranes, which line our body cavities. They are very delicate. The serous membranes, an example of this would be our thoracic cavity, our lung cavity. These are very delicate surfaces. We want to keep that area nice and moist. We want to keep the lubrication of the lining of our lungs, the pleural cavity. Also our heart. We have our pericardium around our heart. That is a serous membrane. We want to keep that when the heart pumps. We want it to pump fluidly and without any friction. So that serous membrane lining that pericardium is going to help do that for us. Then we have our cutaneous membrane. This covers our body and it's dry. So our skin, for example. And then we have our synovial membrane, which is our movable joint cavity. So our knee joint, our shoulder joint, anywhere in our body where we have a joint, that is going to be a synovial membrane. Then we have fascia, which is a connective tissue layer that surrounds our organs. This may be more important than we realize. So fascia helps keep things in place. So especially in our abdominal cavity, we have a lot of fascia. We want to keep our liver where our liver is supposed to be. We want to keep our kidneys where our kidneys are supposed to be. So this fascia helps kind of ground these guys. It keeps them secured, secluded, and attached to that particular part of our body where we want to keep those organs. Okay, so more about those membranes. So the mucosous membrane is, like I said, it lines those exterior passageways. Our examples are our digestive, our respiratory, reproductive, and urinary tracts. The mucosal membranes must be kept moist to facilitate movement, absorption, or secretion. They are lubricated by mucus of our body fluids, and they're supported by the areola connective tissues. Then we have our serous membranes, which line our body cavities, and they're very delicate. This is composed of a mesothelioma, which is supported by our areola connective tissue, which is found in our heart and our lungs. It's delicate and near the connected, and it is delicate and is near connected to the exterior. We have our watery, sorry, it is a watery serous fluid that coats the surface. There's three different types of the serous membranes. We have our pleura, which is our pleural cavity in our lungs, our pericardium, which is our pericardial cavity in our heart, and our peritoneum, which is our peritoneal cavity in our visceral organs. Then we have our cutaneous membrane, which covers our body. This is our dry, thick, and relatively waterproof. This, of course, is our skin. It's composed of stratified squamous epithelium. It's a layer of areola tissue, the underlying dense irregular connective tissue, and it's relatively thick, waterproof, and usually dry. So when you think about the cutaneous membrane, think skin, and this is going to help you describe it very accurately. And then we have our synovial membrane, which of course is our movable joint cavities. This lines those freely movable joint cavities. It lubricates our joint cavity with synovial fluid. It provides oxygen and nutrients to cartilage cells. This is actually not a true epithelium. It develops within the connective tissue, and it lacks a basement membrane. So remember back when we first talked about the epithelium, it had that basement membrane, which helped that basement membrane attached to the connective tissue with those different types of fibers to create that blood supply. So the synovial membrane is not a true epithelium. It does contain gaps between cells, and the synovial fluid and capillaries are continuously exchanging fluids and solutes. And then we have that fascia, which we talked about just a little bit ago. It's that connective tissue layer that surrounds our organs. There's three different types of fascia. We have our superficial, which is directly under our skin, which consists of areola and adipose tissue. Our deep fascia, which is continuous with our capsules, our ligaments, and other connective tissue structures. It consists of dense, irregular connective tissue, and it forms strong, fibrous internal framework. And then we have the subserous fascia, or a visceral fascia, which is our innermost layer of connective tissue. It's located between the deep fascia and the serous membranes lining the body cavities. It consists entirely of areola tissue. This is the fascia that supports, suspends, and cushions those internal organs such as the heart and the lungs and holds all those organs in place where they should be. So now we're going to talk about muscle tissue. There are three different types of muscle tissue. We have skeletal, cardiac, and smooth. So skeletal muscle tissue, it guards our entrances and exits to the digestive, respiratory, urinary tracts. It generates heat, and it protects our internal organs. We have the skeletal muscle is voluntary. It is the only voluntary type of muscle tissue. These are the muscles of the skeletal system, obviously. They are long, cylindrical, and striated, and they are multinucleated. So they have more than one nucleus when you look at them under the microscope. When you look at them under the microscope, you're also going to see those long, cylindrical, striated variations. That first image there at the top under the muscle tissues, you see how it has all those different lines. Those are the striations that you're going to be able to tell when you look at it that is definitely skeletal muscles. The smooth and the cardiac don't have those. Then we have cardiac, which is an involuntary muscle tissue. It is found only in our heart cells. Their special name are cardiocytes. They have interconnected with special junctions, which are called intercalated discs, that help synchronize the cardiocyte contractions. Intercalated discs these junctions are only found in our heart cells. So they're the same thing as a gap junction. The main function of our cardiac muscle is to move blood and maintain our blood pressure. When you look at them under the microscope, they are short, they are branched, they have striations, and they are uninucleated, which only have one nucleus, and they have those intercalated discs. Like I said, those intercalated discs are only found in that cardiac muscle tissue. Then we have our smooth muscle tissue, which is also involuntary. This is found in our viscera. Its job is to move fluids and solids along our digestive tract. It regulates our diameter of our small arteries and among other functions. It's found throughout our body, our skin, our blood vessel walls, and it's found in many organs of various systems. When you look at it under the microscope, it's going to be short, spindle-shaped. It does not have striations, and it is also uninucleated. Then we have our nervous tissue. 98% of our nervous tissue is found in our brain and our spinal cord. The cells of our nervous tissue are called neurons and neuroglia. They are specialized for conduction of the electrical signals, and they are supporting cells. So that's an image of a neuron. So we have at the one end there, we have our nucleus and our nucleolus there in the center. We have our mitochondria, which helps create that ATP energy. Those dendrites there are like our little fingers that help pull the signals, the messages into that neuron. Then we have our axon. So once those dendrites pick up that signal from the previous neuron, then once it processes it in that nucleus and nucleolus, then it sends that signal down that axon to those little sites of contact with the other cells, and that's where it sends it onto the next set of dendrites and onto this next set of neurons. So the functions of our neuroglia. Let's back up. So our neuroglia are our supporting cells of our neurons. So the functions of those neuroglia, they help maintain our physical structure of our nervous tissue. They repair the nervous tissue framework after injury. They perform phagocytosis, and they provide nutrients to neurons. And they help regulate the composition of the interstitial fluid surrounding those neurons. So like I said, they are those supporting cells. Okay, so we kind of touched base on this just a little bit when we were talking about mast cells. So what happens when tissues are injured? So we have an inflammation and regeneration to help restore that homeostasis. So let's take this little guy here. He was out playing and he got a little scrape on his knee. So first we have injury. So that general defense mechanism is activated because we now have that scrape on our knee. So obviously he was out playing on the playground and he fell down, scraped that knee. So now we're exposed to pathogens and toxins, all that dirt and sweat and all those lovely things that little boys get into. He's got all this stuff on his knee. So now it is exposed to the inside of our body because now we have a scrape, we have a cut, and now the outside is exposed to the inside. So this in turn stimulates those mast cells, that mast cell activation that we were talking about, that are going to create that response to inflammation. So those mast cells are going to travel down to that site and start activating. It's going to create a histamine response, that heparin, because now we have a scrape. We want to make sure that we're going to get all of those pathogens out. And the prostaglandins are also going to start to be stimulated by those mast cells. So when that happens, we're going to create more inflammation. So we're on to step 2 now, which is creating more inflammation. So we want to increase our blood flow, because if we increase our blood flow, we're going to have more mast cell activation. More of those guys are going to be able to get down there faster. We're going to have increased vessel permeability. So we're going to have more exchange of all those mast cells, of those lymphocytes, those neutrophils, those eosinophils, those white blood cells. All those things are going to take all those pathogens, because we're going to create that phagocytosis, because we're trying to get rid of all those bad pathogens that we've been exposed to by opening that skin up. And of course, we're going to have more pain because we've scratched ourselves. We have a wound. It's going to create pain. So our body's going to respond, because if we don't respond with pain, we're not going to know that we have injury, and we're not going to know, hey, don't do that. Stop whatever action you're doing, because we don't want to create more injury. So we're going to have increased local temperature. So because we've opened up all of our blood vessels, we've increased that permeability, we've created pain, those mast cells are there in high numbers, we're going to have an increased local temperature because all that work is being done at that site to try to repair that site and make sure that there's no infection that gets anywhere else in our body. We're going to have increased oxygen and nutrients to that site because we want to help fight those pathogens. We're going to have increased phagocytosis because, once again, we want to eat up all that debris and pathogens that don't belong there. We don't want them to get anywhere else in our body. So then we're going to remove those toxins and waste. And then over a period of hours to days, the cleanup process generally succeeds into stimulating the inflammatory stimuli. This causes regeneration. This causes regeneration of our wound, of our scrape, our cut, or whatever it is. So then once we start to get that regeneration, then that stops further mast cell activation. So it tells us mast cells, hey, you've done your job. It's time to start slowing down, go back to your normal job, and go back down to your normal activity level. So as that regeneration starts to occur, the body now recognizes that, hey, I don't need to create more inflammation. I don't need to create more mast cells. Then that scar tissue and that repair of that skin can start to occur. And then we have the little guy there. He's back to his normal tissue condition, and homeostasis has been restored. And he's back playing on the playground again. So I really like this slide. This is a really good example of how everything we just talked about in this chapter 4 kind of all comes together, and how everything plays a role and helps return our body to homeostasis when there's any kind of injury. So, pay attention to this slide, look it over, make sure you understand it completely. If there's any questions about it, please definitely contact me, email me, ask me questions, and I'll walk you through it. All right, so this is the end of chapter 4. Our next chapter is going to be chapter 5. Please, like I said, reach out to me if you have any questions, concerns. Just send me an email and let me know. All right, thank you guys.